Hi there.
How are you?
Good. How are you?
I'm good.
Can you see me okay?
Yeah, I can. I might cut out for a second because I'm gonna try to paste that disclaimer. And for some reason it's not. Just give me 1 second. If we cut off, we'll like do this whole thing. Are we still there? We're still there. Okay, hopefully this will work, but it's not working. Okay.
You can just say the disclaimer.
Yeah, we'll say it, and then I'll post it on the story afterwards, just so that everybody remembers. I guess let's just. How about you introduce yourself, and then we'll disclaim.
Okay, we'll exclaim or disclaim. Okay, my name is Elyse Dubo. I am a youth psychiatrist and adult psychiatrist. I'm in Toronto. I work in a community practice that we called Mind Health Toronto because we wanted the focus on health instead of mental illness. So that says a little bit about my sort of bend. I'm really focused on wellness and helping people move beyond their mental health issues. And I do a combination of medication management and therapy. And I'm really big on positive psychology. And if people don't know what that is, it's all about being able to be in control of your thoughts and your mood and your actions and carving out your own happiness and your own success. So I really believe that that's very valuable.
Is that like common that a psychiatrist will also do the therapeutic aspect of care, or is that rare?
No, it's not rare, and it depends on the place and community. We are all trained to do various types of therapy. It just depends on sort of the, I guess, the community in which people are working. So there are people, in Ontario, lots of psychiatrists are doing psychotherapy that's covered by OHIP. And it's true across Canada to be covered like that. In the US,
wow.
It would all be private pay. So unless you're in a hospital, then I trained in the US, so I know that like in a hospital, you can have coverage, even in the outpatient department of a hospital, sometimes there can be coverage for psychotherapy. Sometimes it's by managed care. So which is.
So that's important for people to know, because I think that a huge barrier to people accessing or feeling like they could access support is money. And I know that a lot of therapists charge a lot, but if somebody needs a psychiatrist and a psychologist, and there are psychiatrists that are kind of playing both roles, that's really important for people to be aware of, because I don't think that's a common knowledge.
Yeah, it's true, because I will see somebody and then they'll say, that they want therapy and they think they have to go look for somebody else. But I'm in that camp where I will do both. But I can't do it for everybody, though, because I wouldn't be able to see new patients if I filled up only with psychotherapy. So, it just depends on what I can offer and what the patient needs. So some people prefer to go to a psychologist or or social worker because they feel it's less stigmatizing than seeing a psychiatrist. And there's also community mental health centers that have government grants that pay for counseling as well. So in Ontario anyways. And that's probably true all over the place. There's all kinds of resources out there that people may not know about where there is coverage for counseling.
Wow. Okay, so that's really important to know. Maybe we can post some of those resources afterwards.
I guess it just depends on where people are coming on from.
Yeah. I mean, we do have on our website, jproactive.com. So we're kind of like starting to accumulate resources, and hopefully we'll continue to add as community members share. So if anyone that's on here wants to share resources that they've found, I think this is really important to know. But I guess the topic is really about meds. So,
True.
But so I guess before we start, I just want to make sure that everyone knows, and I'm going to post this disclaimer on our story after, just to remind everyone that this does not replace, that this live is for informational purposes only, and that it doesn't replace the need to seek one-on-one professional counsel, because every individual would be very different, and, you know, and everybody has a history that is really relevant to getting the proper care, right?
Right. And when the first step in getting well is education. So the more you learn about, you know, the condition you might have and what is available to help with that, the better. So this is really an educational type of conversation.
Perfect. So should we delve into...
Sure.
Okay. Do you want to give like maybe an overview of, I guess there's a lot of misconceptions about medications. I think like a lot of people, I sent you some of the things, a lot of people sent in questions in advance.
They were good questions.
Yeah. But I mean, I've heard tons of questions that, you know, people are afraid to start them because they would be addictive, or people think that they don't know when they might need medication, or, you know, I mean, we can, I guess.
That's a good place to start, is when would you consider needing medication? And I think that from my point of view, and I think, you know, within the field of psychiatry, it really has to do with how impairing are your symptoms, because we don't need to take medications if we're just dealing with something. You know, if we're anxious and maybe down because we're dealing with a life event, a loss or something like that. But if you're in a situation where you have symptoms, you know, for a long time, and they're getting in the way of you being able to work or go to school, or have relationships, you know, then, you know, it's really causing a degree of impairment, and that's a criteria that we use for prescribing medications. So I think it's a quality of life thing, but for some people it's a life or death thing also, because, you know, their symptoms can be so severe that it's causing them to, you know, have very serious thoughts of suicide or self-harm, and, you know, that they can't live with their symptoms. So you know, symptoms like anxiety can be extremely disabling. People, I think, underestimate how disabling anxiety can be. And I mean, of course, we can relate a bit more to how depression can, you know, make people not function well, but anxiety can be just as severe, if not more severe. So yeah, we're always looking at impairment.
Okay. And would, like, I guess there's different categories of impairment, right? Because like a personality disorder would kind of look a little bit different than like anxiety and.
Right. You would, I mean, a personality disorder you wouldn't treat necessarily in most cases with medication. It would be if the person had an overlying or underlying, you know, depression or anxiety, or other kind of mood disorder, because, you know, we can't treat personality issues with medications. But, you know, any kind of mental health issue can interfere with your concentration, can interfere with your sleep, your appetite. So there's a lot of, so when we talk about impairment and functioning, it also has to do with the way our body is functioning. You know, that there's a lot of what we call biological signs of mental health issues that show us that it's now at the degree of an illness, because it's interfering with our biological functions like sleep, concentration, drive, and appetite regulation, those kinds of things. So that those are common symptoms of depression that would make us think about medications also, because it's a sign that it's gone beyond just how you feel, but it's how you're functioning.
So if somebody came to you and they were like feeling overwhelmingly low, but it wasn't debilitating, so you would treat them with therapy as opposed to medication.
Right. Yeah. Because you want to help with coping, help them sort out what the life issue is that's affecting them. If it was, if it did go to the level where they weren't sleeping or they weren't able to concentrate and function at work or school, then we would consider medications. But by and large, if it's a life event, we try, to avoid using medications right off the bat and try to solve the problem first and help the person.
That's interesting. So
it's not what you thought?
No, well, no, it is kind of what I did think, except, so I was talking to, I go to an osteopath sometimes, and so I never know, like, if a doctor's on, like.
Oh yeah, no, I'm really into alternative medicine, actually. I'm unlike a lot of my colleagues, I really embrace alternative medicine.
So she's like amazing. I love her. It kind of feels like therapy when I go to her, but she said to me that a lot of people aren't comfortable with pain, and sometimes the pain, like by fighting the pain, you're actually creating more pain, and that it could be like that for the brain as well, that like oftentimes we think that things are supposed to be happy all the time and we have unrealistic expectations. And so if we're feeling like stress or anxious but not anxiety, that we think we have anxiety but we're really just anxious and we don't know how to deal with difficult feelings.
Yes, I think that's right. A lot of people think, and they may be raised that way, that certain feelings are not permissible, like anger or, anxiety. They think that they're weak, or they just really have to cut those feelings out, or there could be repercussions. Maybe they learned that in their family life. And so a lot of what happens in therapy is teaching people to accept their own feelings, and even if they're very strong, extreme feelings of distress and anxiety, overwhelm, because if you can't accept your own feelings, you're not connected to yourself, and you can't really make any decisions or solve a problem if you don't know exactly how you feel. So it's important to learn to withstand all your feelings, not judge them, and be able to kind of make friends with them, and just allow them. And that, so being able to do that is a sign that, you're not stuck in something that's at the illness level. You're just dealing with something, and it can be on a spectrum, right, of severity. And it can be, we talk about state versus trait, like you could have someone who tends towards anxiety and depression, and that's a trait. But then on top of that, they could be in a state of depression or in an episode of severe anxiety or panic attacks or post-traumatic stress disorder or something like that. So, that it's important to know your feelings also, so if something is really wrong, it's not you, and you're not yourself, right? So, and sometimes people are prone to depression if they don't allow certain feelings, like anger is often something, if you disavow anger, it can eventually lead to depression for some people who are prone. Yeah.
Wow. So do you think that this might be like a question that you don't want to answer, so just tell me, but do you think that there are a lot of psychiatrists that prescribe medication based on somebody being anxious, like overly anxious, as opposed to anxiety disorder because it's an easier fix, or it's not?
I don't think so. I think there's this myth that that psychiatrists are just wanting to write a prescription. Now, of course, I can't talk for all psychiatrists, and there may be people who have extremely busy practices and they just need to, they can't take the time. But I think that medication is one thing in our toolbox, and hopefully most psychiatrists or family doctors, because family doctors prescribe a lot of medications for depression and anxiety, that they're kind of looking at the overall criteria to know when it's something that warrants medication instead of just, writing a prescription and sending somebody off. So, but, that being said, if you're going to see your family doctor and they have an extraordinarily busy practice, or they could have a really rushed and hurried day and they could be completely burnt out, as many are, then, you might feel like, oh, all they did was write me a prescription. They didn't even hear me, but that might have been all they could offer at that point. That unfortunately that's a flaw in the system, but in most places, doctors are very, overburdened, and so they may not have the time to spend. So it just depends who your doctor is and what other resources they may have, and what other support staff they may have, and whether you let them know in advance. Like if it's a family doctor, you'd probably want to book a counseling session, which is a longer session. But if you just come for a regular checkup and you go in and and they've only allotted 10 minutes, then you will end up feeling like they didn't really care, or they didn't take the time. But if they know in advance that it's what we call a counseling session for a family doctor, then they can take the time. Psychiatrists they usually book longer appointments because they know every patient is going to have more of a story to tell. So
I didn't know that family doctors do counseling.
They do, yeah. Family doctors are really the front line for mental health, and they try to manage quite a lot and refer, usually when it feels a little bit out of their area of expertise. But they're doing bread and butter prescribing and counseling for all kinds of mental health concerns. And not every family doctor, it depends on what their interests are. Some actually even do cognitive behavior therapy.
That's really interesting.
Very skilled.
It seems like there's a lot for them to brush up on, and there's like so much current research there that's a little bit a lot newer than when they maybe went to medical school 10-20 years earlier. That like, how would they, like, I mean, I guess that's not really part of, maybe it is part of the conversation.
Yeah, all doctors are required to keep up their education, like to keep their specialties or their licenses. They're required to have a certain number of credits per year that they've done education. So and they want to, and there are many reading journals, and there's so many things now, like podcasts. There's so much other kinds of mobile education you can do now. So yeah, doctors are spending a lot of time keeping up with the changes, and how you manage a psychiatric problem in a family practice will be different than how you manage a psychiatric problem in a psychiatrist's office. So they have their own ways of doing things also. Yeah. So I emphasize this because you do not have to see a psychiatrist to be prescribed medications for depression or anxiety. Now, not all family doctors are really comfortable with it, but many are, and it's the first place to go, because in most places you do need a referral anyways to see a psychiatrist, but there are much fewer psychiatrists, so there's always going to be a wait. So you might as well first go to your family doctor, and perhaps they can start a medication, and then by the time you see the psychiatrist, it can be fine-tuned, or you may not even need to see the psychiatrist.
Wow. Okay. That's good information.
Mm-hmm.
Okay, so it seems like, I mean, you're referring a lot to anxiety and depression. How would a family doctor, how would it go if there were other types of mental illness that it's not always so simple, right?
Right. So they may just get a gist of it, and then they may decide to refer because it's too complex. Like psychiatric specialists should always be seeing the more complex things. So, so family doctors can treat the bread and butter sort of textbook things, you know, and then they will refer for the more complex situations.
Okay. Okay, so can we get into more specifics of like different categories of medications and their uses and somebody just asked who can prescribe meds besides
Right.
a psychiatrist or family doctor.
A nurse practitioner can. For like more and more, there are nurse practitioners who are frontline. So, I mean, and then, you know, if it's a kid, a pediatrician, an internist, you know, depends on people's, you know, comfort level. Like, for example, people who have a heart attack, there's a high rate of depression when you have a heart attack. So I would imagine many cardiologists are comfortable prescribing antidepressants, you know, so, or anti-anxiety medications. I could be wrong about that, but, you know, kind of, it's kind of part of every aspect of medicine. But as I said, the more complex cases would go to the psychiatrist.
So somebody just asked, like, privately, wouldn't it be better to get a referral, since most meds can have side effects and there's different nuances, and then getting a proper diagnosis I don't really understand the.
But yeah, I'm getting the gist of that. I think that in many cases, a family doctor can't take the time necessary to do a whole evaluation. So, but they can recognize the problem. It doesn't, just like in an emergency room, like you don't have the time, but you can identify that there's a depression or an anxiety disorder, and start a treatment, but then refer to do a more broader evaluation, because a lot of it isn't that complex. And you know, most doctors are familiar with the side effects of the basic antidepressants or anti-anxiety medication, but you know, then psychiatrists are, you know, maybe using categories of medications that a family doctor isn't as comfortable with. So you know, if someone doesn't respond to our typical kinds of medications that we would normally start with.
And then also I mean, this is what I've been told, that medication on its own doesn't really have the same results as medication with
therapy.
With therapy.
Yeah, so that's I mean, there have been studies to show that you get maybe a more long-term outcome, like positive outcome, when you combine the two. But there's also studies to show like cognitive behavior therapy can be just as effective for some people as medications. And not everybody who takes medications needs therapy. Like, just for example, say you're just a high functioning person, and for whatever reason, because it runs in your family and maybe there was a stress to bring it on, you developed a depression. And it's not based on deep rooted, you know, issues in your family. It was a biological illness that came over you. And so medications may completely resolve it. And sometimes people need some therapy to just deal with what just happened to them and how it, you know, took them out of the game of life, if they had to, you know, take a break from work or school. But it's not that there's always a root cause in their life. Sometimes it really is just like developing high blood pressure or diabetes. It runs in your family. And I've seen lots of people where when I first evaluate them, I think, oh my God, they're going to need a lot of therapy because their self-esteem is so bad. And you treat them with the medications, and low self-esteem and, you know, worrying and all that, it can be part of the depression. And when you even guilty feelings can be symptoms of depression. And when the depression is resolved from the medications, all those things go away and there's no need for therapy. So
interesting.
so often, you know, depends on what I know about how they were functioning before they developed the depression or anxiety, and then, or how chronic it's been. If people have chronic mood or anxiety disorders, then a lot of what they're dealing with is the fallout from that, the losses and how it's impacted their life and having to cope with it like any chronic illness. If you have diabetes, or, you've had a heart attack, or you have multiple sclerosis or something like that, oftentimes you're going to need some counseling or therapy to help cope with that. So so a myth, I think, is that any kind of mood or anxiety disorder has deep-rooted causes. No, that not necessarily. Some do.
It's so interesting because so one of the therapists that we interviewed said that all mental illness is rooted in trauma. And I actually just read, or I'm in the middle of it, I'm almost finished, The Body Keeps the Score, about like trauma and the body and how, and it follows a similar line of thought.
I can tell you how, like, I see countless number of, young people coming from amazing families, their life has been happy, and they start high school or they start university and they develop a depression or they develop some anxiety, and there was no trauma. So that is not true. I would disagree with that.
Okay. It's really cool how everybody has, like you hear different things. Actually, a lot of the therapists that we've interviewed had very different perspectives. So it's very cool to hear all the, personal research and approaches. And you're our first psychiatrist. So
okay. Now I'll say that the more negative events you've had in your life, the more likely it is that you will have chronic mental health issues. But some people go about their life just fine, have an episode of depression, take medication or plus or minus therapy, it goes away and never to be seen again. Or sometimes it does come back again. So, but it's not a sign of some kind of, trauma or, failure to cope with things. It was pre-programmed in their genes. There's huge genetic basis to mental illness.
So, is it so? I guess that's a good lead-in to genetic mental illness. So you talked about anxiety and depression. There's a little bit more of like, let's say borderline personality. No, you said personality disorder. You don't.
Yeah, that's a whole nother category. I would like, because people with personality disorders can have other like mood and anxiety disorders, and that's what would be treated with the medication. So I would and like that's a different category.
What category would, like, bipolar or?
Yeah, so bipolar is a mood disorder. So that most people with bipolar disorder, depending on the severity, would need medication. There's different degrees, like there's a spectrum of bipolar disorder. So those who have the most severe, where they end up hospitalized from full-on manic episodes, usually with psychotic symptoms, some of those patients, if they aren't on medications, they will just get sick again so quickly. And whereas others who have more shades of bipolar may not need to be on medication. They may be able to use more holistic approaches like meditation and yoga and things like that to manage stress to keep their mood stable. So
it's very individual.
Yeah. I mean, if someone has a classic, what we call bipolar type 1, I've not seen any patient with bipolar type 1 stay stable without medications. And the problem with that is also that the more manic episodes somebody has, it primes the brain to have more manic episodes. It's what we call a kindling effect. So the brain it more easily gets sick again. It's kind of like if you think about a heart attack, the more heart attacks somebody has, the more likely they're going to have another heart attack. So, so we look at protecting the brain like using medications, to prevent further manic episodes. If you were to plot it on a graph, and I've had patients who, didn't want to take medications, and I have plotted it on a graph for them, and like their episodes get worse and worse, more severe as time goes on. And so medications can actually protect the brain from future manic episodes or psychotic episodes. So there's a big protective role as well.
So how would you know if it was the type that would require ongoing medication or that could be treated with more holistic approaches?
So with bipolar disorder, the defining feature would be if they've had manic episodes that have landed them in the hospital or should have landed them in the hospital because they were so manic and likely psychotic that they were no longer in touch with reality. So their brain was having a massive episode that would be a lot like taking a psychedelic drug in some cases, like a bad trip, or could be a happy trip that turns into a scary trip. So, it's the quite severe disorder in that case. And, but then I've seen patients be able to be stable for, lots and lots of years, when especially if they've intervened early and prevented future episodes. I actually have the luxury in my situation of having people I follow from teens to now in their 30s. And there's one gentleman that I can think of that he had a manic episode when he was a teenager. And he was one of the very few patients that I've had as teenagers who stayed compliant with medications, stayed away from weed, which was a big trigger for him, and has never been hospitalized again. And stays on medication, does not have symptoms. And he did try at one point to go off the medications, had a bit of recurrence, so he decided to stay on it. So
one of the therapists that we've interviewed said that in her practice, she said that one of the most mentally healthy people that she knows has bipolar because she actively was working on herself, and you could have a very mentally healthy person with mental illness.
That's right.
Or you could have very mentally unhealthy people that don't have mental illness.
I totally agree with that. And if you have the combination of mentally unhealthy and mental illness, that's going to require a lot more, intervention.
Yeah, that I can imagine.
Yeah, like a lot of childhood trauma and things that have set your, mindset onto a very negative course and maybe got you into some very negative behavior. And then you develop, depression and substance abuse. And like the more things you pile on, the more there is to deal with.
Wow. There were so many questions, and I feel like
I have the list here, actually.
Oh, okay.
Yeah, I wrote them out just because I couldn't my printer wasn't working. But I like this question. Someone asked, what if someone is too anxious to start meds due to worry about side effects or feeling out of control? I think that's a very fair question because you don't know how you're going to feel when you take the medication. So it is a bit of a leap of faith. And if you're someone who's had side effects on some people are extremely sensitive to any kind of medication, and even like an Advil or something like that. So you have I think you have to weigh out what would be worse, to continue with your current degree of symptoms, or maybe have like upset stomach, or maybe the medications interfere with your sleep, or maybe they make you tired, or maybe they even make you gain weight. So, but all of that is reversible. So if you don't like the medications, it is your choice to stop the medications. It's not a life sentence. And it can be very much a trial and error kind of thing. So as long as you're, working with a doctor that is listening and, wants to work with you around finding the right match for you with medication and side effects and effectiveness, then you know, you should be fine. And you can start at baby doses, you know, if you're worried. You can start at very tiny doses. And just to know that you always are in control, you can always stop them if you don't like them. And all the side effects will be completely reversible. So
for all meds.
Mm-hmm. Yeah, there's nothing that's going to change you forever. It's not like that. People often think that.
Yeah, and also people think that they're addictive. So once you start that, is that true?
That's another myth. So what's addictive are the medications that are sort of more like people know Valium, you know, like so lorazepam or clonazepam, things that are prescribed for anxiety. If somebody abuses them, they're not addictive per se if you're taking them as prescribed, but if you take more and more and more, then you may find yourself completely addicted to them. Now, some medications, when you can't stop cold turkey, you have to taper them off because you will get what we call withdrawal side effects. That is not a sign of addiction. That's just a sign of how the medications were, you know, impacting your neurotransmitters, and you have to be very gentle in taking them down. So, but you can't be addicted to an antidepressant, for example. You can't be addicted to the medications for bipolar disorder. An addiction really is a behavior. It's really more about how you're using them, and if you're abusing them, then it's addiction.
So like if you're, you know, taking, I don't know, like the teenagers have like sometimes we'll take somebody else's ADHD medication if
right
to be able to study.
Yeah, they can be abusing them. They could, but they're not. That's also not an addictive substance. Addiction means that you can't live without it, or you're going to go into, you know, massive withdrawal side effects, and you can't get off of it. And you're, you know, like alcohol. You know, people who are addicted to alcohol or cocaine or things like that. So, you don't have to worry about being addicted to most medications for you know, that are prescribed for mental illness. That's not really a factor. So people say also don't want to be dependent on it, right? So that's another one that I hear commonly, and I understand that. But the thing is, it's kind of like for a long time before I accepted that I needed glasses, like I didn't need to wear glasses until the last few years, and I would pretend I didn't, but everything would be blurry. So like, okay, I don't want to get dependent on using my glasses, which is really what I said to myself. But eventually I had to accept that I will not function very well if I don't wear my glasses. So it's not that you get dependent physically or emotionally on medication. If it helps you function better, then it's just something that you should keep taking. That's all. It's not, you know, it's not a sign of weakness that your body, your biochemistry needed that medication. It's not a virtue to get off the medication to show that you're stronger than your illness. You know, it'd be like saying, I'm not going to take my insulin if I'm diabetic. And, you know, and then you might end up in a diabetic coma in the hospital, but it wasn't a virtue to think you were strong enough to not need it. So people have a hard time equating mental illness with other kinds of physical illness. And the brain is an organ, just like the heart, just like the kidneys, just like the pancreas, anything else. We know less about it because we can't just open it up and study it as easily. So, and a lot of it is happening on a level that we can't see, though we're getting better and better with imaging, you know, really progressive imaging techniques and things like that. But we have to separate out ourselves from a mental illness. We are not the mental illness. The mental illness does not define you. It is not allowing you to be you. So I often will explain that if the medications take away the symptoms and allow you to be you, well, that's a good thing, because now you are in full control.
So I've heard people say that they don't feel like themselves.
So that's
right. Medication.
So that could be side effects, right? So some of the antidepressants, like in the category of the SSRIs, like Prozac or Zoloft or Celexa or any of those, they may there's a small percentage of people that feel kind of like blunted on them, like they don't have their full range of emotion. So that is not agreeing with them. It's not the right fit for them. There may be other ones that are. Some people can't take any medications. They all make them feel crappy. So, you know, that's just, you know, the way it is. But then there's tons of people who take them and they feel like their symptoms are gone and now they're out of their way. They don't have to think about it. They take the medications like they would any kind of supplement, and they go on their merry way. You know, the fact that I treat a lot of teenagers in university age, you know, I've seen so many kids fall off what would be the normal trajectory of their life because of mental illness. And if it weren't for medications, they would not move forward, you know, because they would not be able to. So it's life-saving in that way, that, you know, because the longer you have symptoms, you then start to think that that's you. You then start to think that all those negative thoughts or those anxious thoughts are you and your personality, and you're just weak and, you know, you can't handle things. Whereas those are, you know, very well could just be biological symptoms that go away with medication. So, you know, people are often really surprised. It's more clear when somebody was perfectly fine and then they develop a depression and they know it's not them. They know it's not their self, right? But sometimes people, if they develop it young, especially, and it was never identified, and then it colors their personality development and, you know, carries forward. And then it's very hard to sometimes separate out what's them and what's the depression. And then once they get it treated, they're very surprised, you know, that it wasn't all them.
That's interesting. I was at a course last week, and somebody, like, it was I took a mental health first aid course.
Oh, yeah.
And one of the people were saying that their friend who was bipolar said that they felt the most alive and like themselves when they were manic and not on meds.
Well, mania is a very interesting thing, because before you get, if you don't get manic to the point of needing hospitalization, you're what we call hypomanic, which is an elevated state of awareness, of mood, of, you know, it's kind of like, it's one of the few mental illnesses that offer some advantages, because in that state people are often more creative and they're more outgoing and they, you know, get great ideas for businesses and things like that. So, but so there may be a very few people who can be in that state and then go back to normal and not have anything bad happen. But most people with bipolar disorder, you know, they'll either end up, be in that state, then end up in a really bad depression that is crippling for them, or they may go to a much more severe state of mania. So, but that you know, I can understand that. That would be like being on ecstasy or something, you know, and like not that I've ever tried it, but just that, like, it's heightening all your senses. So
yeah,
I can understand that comment.
Yeah, so they said that their friend just felt very, like, as you said before, blunted. Like they just felt
on the
like
medication.
they were dull and blunted and not themselves, and they felt more like themselves in that case, but then they were a danger to themselves. So
yeah.
So then what would you do as far as medication? Like, what would you do in that case? Where
it's a lot of trial and error, and sometimes it's using really low doses because somebody's too sensitive. You know, trying to combine two different things at very low doses, and so you have to be, you know, the doctor has to be willing to take a very individualized approach and to really listen and work collaboratively with the patient, so that, you know, you want to, if the goal is to be stable and have good quality of life, side effects are not going to give you a good quality of life. So right. I don't think you just say, well, like, tough it out. You know, you just have to deal with the side effects. I never feel that way, I always try to find the right solution for somebody, because, weight gain is one. Like, I see, people, especially women, gaining a lot of weight on antidepressants. That is not a good outcome. So we do not want that. And so you have to try to find a way, another way that won't cause that. So it can be a lot of trial and error.
And also, so there's been a lot of questions about, let's say like ADHD. Would that fall into a similar? So I've been asked quite a few times, I don't really know the answer to this. So like, if you're on ADHD medication as a child, is that something that you'll always be on, or is it something you could grow out of, or is it?
Yeah, about a third of people outgrow ADHD for sure. And then it also depends on what kind of work you do. So somebody, with mainly just attentional problems, they may not function well in a traditional school environment where it's, tedious rote learning. But if they're a creative person and they're going into a creative field, their ability to think laterally and on many channels at the same time can be an asset to creativity. So you don't always have to treat that. It's, again, degree of impairment. And if it's interfering with their personal life, because people say they never pay attention, or they're being absent-minded and they're forgetting things and all that kind of thing, it just really depends. So, or sometimes they'll just take medications when they need to be in a very focused state. So that's, I think for the treatment of ADHD, medications can be very flexible, and definitely you're not guaranteed to need them as an adult if you needed them as a child.
Yeah, I heard somebody call it a life sentence.
No.
So it's not a life sentence.
No. I mean, for some people will need it through their life, or they won't be able to function in a job. It just depends. There's, again, a big spectrum of severity.
Okay, that's good to know. Should we answer some more of the questions?
Yeah. When someone asked, how and when is it appropriate to wean off psychiatric medications? So, there's a rule of thumb that if you've had 2 or more episodes of depression, that you should probably stay on medications long term, because you're more likely to have another episode. That means if you've had 1 episode of depression, it went away, you were on the medications for a good chunk of time. So for adults, the research shows a minimum of 6 months of wellness, then you could wean off the medication. Anxiety can often be a more chronic kind of thing, but people can learn good coping skills, and maybe their life circumstances have changed, they're not in as stressful a job or whatever, they may not need to stay on their medications. So it is not a life sentence by any means. Severe bipolar disorder most likely need to stay on medications. Severe recurrent depression, same thing. Or severe chronic anxiety, life will be better if you have it controlled.
What about so somebody was also asking, I can't remember if they wrote in to the questions or but about somebody who's suicidal.
No, that wasn't in the questions. What was the question?
So whether there's medications to treat for that, or that's therapy.
Well, it just depends what it's part of. So if someone's suicidal as part of a severe depression where they're not even like thinking like their usual selves, because depression can cause you to get very inward in your thinking, and even to a level where you're not in touch with reality. Like you may think that you're such a bad person that you deserve to die. And it's just because the illness is making you think that way. Well, then, yeah, medications and probably being somewhere safe, like a hospital, will be important. But if you're somebody who just has a long-term problem with coping with stress, and that sort of comes to mind as the first thing that you think of when you're stressed out, well, then therapy is really important to teach good coping skills. And so there's, again, it really depends on the context of the suicidal feelings.
Okay.
Somebody asked, is CBD effective? So I actually work in that field as well. I work, I do consultative work for medical cannabis clinics as a psychiatrist, mainly working with patients who have chronic pain and psychiatric difficulties, or even just primary psychiatric difficulties where they haven't responded to medications, or they didn't even maybe want to try medications. And CBD oil can be a miracle, honestly. Like I'm telling you that it's the most optimistic thing that I've seen in psychiatry.
Wow.
And particularly for more difficult to treat things like social anxiety. Oftentimes, like someone could have depression and social anxiety, and the depression got better with the medications, but the social anxiety didn't. And even with therapy, social anxiety is difficult to treat. But for some reason, CBD oil seems to really help social anxiety. It helps anxiety in general, but it's the only thing I've really seen very effective for social anxiety. And the other category that it is unbelievably effective is PTSD. And, I've seen first responders, veterans, people who have been, assaulted, people even with childhood trauma who still have PTSD. And there's some way in which, through complex mechanisms in the brain, that CBD oil seems to stabilize the nervous system and just shut down that hyperarousal that's part of PTSD. And it can help people even with ADHD, for bipolar disorder. It can help decrease anxiety, which is often a trigger for people to develop a manic episode. So it can be just an extra thing that keeps people more stable and helps regulate sleep as well. So is
there any like mind altering properties to it, or it's just?
No. So CBD oil is the other compound from the marijuana plant, and it does, so there's THC and CBD, and CBD was identified and studied for like decades, especially in Israel. It actually, some of the original studies on CBD come from Israel 40 years ago, and they were reporting on the studies in non-medical journals, but in scientific journals, but the medical community just didn't pick up on it. And then eventually, maybe 20 years ago, the National Institute of Health started funding more research in Israel. And they had to like somehow get the products over there. And so it's become only more recently within the mainstream, and still many doctors are not familiar with it and would not necessarily be on board until they start seeing their own patients come in saying, the CBD oil changed everything. And
wow.
So it's very interesting. So I've
what about for children?
So it's used in children, especially when like there's a chronic seizure disorder where they just don't stop having seizures called Dravet syndrome. And in that syndrome, CBD oil can stop the seizures. And there are and kids with PTSD, there's case reports. So there's no big studies yet. There is for Dravet syndrome, and also for Tourette's, it can be very helpful. Wow. So there's
what about like chronic pain?
Yeah, so chronic pain for sure. It's very anti-inflammatory, and wow. It blocks nerve pain. Yeah, it's very, very helpful. So in Canada, we have a very tight regulation on the production of CBD, and so we know that if it's from a licensed producer, that it is safe, and we know that there's no toxins in it, and it just has like very trace amounts of THC because it comes from the marijuana plant. In the US, there is no such regulation. So it is a bit trickier, if there's anyone on here from the US, to navigate the world of CBD. A lot of the CBD there would be from hemp, which has no THC in it and can be very helpful. And then there may be places, you know, especially where marijuana is legal, to find the kind of CBD oil we have here, though it isn't regulated in the same way. So you have to really research the company and know that they're removing pesticides and toxins from it, or that they're not using pesticides and things like that. So, and that what the, to know that it actually has in it what it says it has in. So,
but would something like that need to be through a medical practitioner, or like if somebody was in legal places where it was legal, they could kind of like self-medicate, but then are there any contraindications with other medications?
Yeah, there's no serious side effects or contraindications. So it would be fine to do that. Like you would have to be taking truckloads of it to have any kind of major issue. You can't overdose on it. It's been determined as safe. Like the National Institute of Health and the World Health Organization have said it's safe for all ages. So
wow.
Yeah. So yeah, people can get that and try it, and make sure that it's reputable where they're getting it from.
You're saying like children, it would.
Well, if you're going to use it, if children are going to use it, you'd probably want to use, unless they had a serious illness, you can use the hemp-based CBD oil because there's 0 THC in it. And they even use that in pets. So you'll see there's a whole world out there of CBD oil for cats and dogs and other animals. So, and it helps with their pain. If an older dog has arthritis, it really helps with that. Like, it's really quite remarkable.
That's so interesting.
Yeah.
So somebody like who's suffering with arthritis, that would be like a go-to.
Yeah, definitely. And in my practice, I've seen tons of people who were prescribed opiates and really have no quality of life with that because they're doped up, and they didn't even help their pain in the first place, be able to get off the opiates, like things like morphine or Percocet or OxyContin, and fentanyl even, like with the help of CBD oil. Yeah. And then the CBD oil helps them far more. And they're amazed. Like I've seen people in my clinic with CBD oil. I've seen from like age 16 to 98, and people saying this has changed my life. So
wow, that's amazing. I guess there's a lot of stigma about it. So yeah, it's very interesting to hear.
Even amongst doctors, many doctors will just categorize medical marijuana together, and they don't even know the differentiation between CBD and THC. And one of the first things they'll say is there isn't enough research. Well, we don't have the kinds of studies that we'd like to have yet, but now there's major academic institutions doing the research right now so that we have the double-blind controlled studies. But there's a ton of clinical evidence. And so, those who are working in that field you know, just every day see the evidence and the safety. So there's a lot of off-label uses of medications in all kinds of areas of medicine that those off-label uses have not been studied, but those medications have serious side effects. And so it's totally changed the way I even think about what's, you know, if someone doesn't respond well to what particular medication, I might have in the past brought in another medication that had more side effects. But now I'm thinking, no, I'm going to bring in CBD oil and see what the difference is.
Wow.
Yeah.
That's really interesting. Thank you, whoever asked that question. That was a very
I was happy they did, because I always like to educate about that. And someone asked about starting meds in pregnancy. So that really requires someone who's expert in that area, because it really depends on the type of illness somebody has and what the risks would be if they weren't treated versus the possible risk medications. And there are risks in the first trimester of certain medications, even simple anti-anxiety medications like lorazepam, you know, can be associated with a cleft palate, cleft lip. So you have to know what you're doing in that area. So that would definitely require, there are psychiatrists that have that as their area of expertise. So that you would definitely want to work with a psychiatrist who knows about it.
And I guess that some of the pros might outweigh the cons, and because if somebody has a severe,
someone has a severe illness that would be a risk to their life, or you know, where they could harm themselves or end up in the hospital, then you have to work with what we know to be the least risky types of medications to use. And there's definitely studies to show that, you know, that there are antidepressants that seem to have, you know, minimal risk to the fetus. And so, you know, you just have to weigh those things. And like, similarly, like if you're developing postpartum depression and you're breastfeeding, you have to weigh out, well, what's the risk of having the postpartum depression and not bonding with your baby and maybe even doing dangerous things, you know, versus this small potential that, you know, could get into the breast milk. Or maybe if you're on a different kind of medication, that it would outweigh breastfeeding because you need to have that medication to stay well. So there's a lot of nuances there.
That's a good question too.
So I think we covered most of it, actually. I think over, you know, the course of our conversation, we covered all the ones that, well, like someone said, can meds mess with your body and cause you to gain weight or lose weight? There's definitely medications that are known to cause weight gain. So you want to know that. And,
is there anything that causes weight loss?
There are a few antidepressants that sometimes can cause weight loss, or one mood stabilizer called Topamax that can cause weight loss, or the ADHD medications can certainly sometimes cause weight loss because they take away appetite. So it just depends. But none of these medications are used for weight loss, like for people who need to lose weight, but they can be a side effect. But weight gain is far more common. Which is not good if you're depressed.
Right, if somebody's depressed.
Yeah,
that would be
so you have to, as soon as you see signs of that, you want to switch to something else. So you don't want to wait till someone's gained 30 pounds and, you know. So
this was really informative.
Good.
Thank you so much.
You're welcome.
And I really liked what you were saying about like you really addressed a lot of what we try to push as far as, you know, the brain health is just as important as physical health, as any other healthy.
And just because somebody needs medication, they shouldn't feel hopeless. They shouldn't feel like they're damaged or they have no control over things, because the medication is going to correct whatever caused that episode to begin with, and then you're in full control. Then you can use all your resources to do all the good things to take care of yourself, you know, to learn good coping skills, to, you know, use more holistic approaches, healthier lifestyle, all of that. And that will help prevent further recurrences. So the more you do to take care of yourself, the more you will be well. And if taking medication is part of that, don't feel bad about it, because it's just the way it is, you know, like if you have to take medication for high cholesterol or anything else. So, but it's not a sign of weakness.
And thank God we have this research today. Like in the past, you know, people would be, you know, put into institutions, whereas today, you know, if with proper treatment, people could live very, like, you know, they could live a life that in other generations they wouldn't have been able to live.
Right. They wouldn't have the quality of life or the success. Yeah, I mean, having mental illness and needing medication has no correlation to success in your life. In fact, if you can channel all the hardship into lessons that you've learned and improve yourself as a person, and really be proud that you've been resilient and that you've had the strength to overcome your difficulty and to take care of it, then that leads to more success. So, you know, it's very important to always, you know, take stock of what any experience in life teaches you. Nothing is a failure unless you blame other people and don't take stock and learn lessons from it.
Do you have any book recommendations if anybody wants to learn more?
Particularly around medications?
Yeah.
I'm not sure what's out there now, but I'm sure there must be, you know, in the self-help section, I'm not sure. But I mean, there are, for people with bipolar disorder, there's the classic book written by Kay Jameson, who is a psychologist who treated bipolar disorder. She worked at the National Institute of Mental.
Oh, I read this. Well, it's her autobiography, right?
Yeah, An Unquiet Mind.
Yeah, it was probably one of the most beautifully written books I've ever read. It was incredible.
Yeah, that's a really good account of what it's like to live with that illness and to live with medication side effects. So that's a very interesting book. I'm sure there's lots more. I'm not really up to date as to what is in the lay literature right now I'm sure there's tons, you know, but I'd say that the more you also focus on what you can control, so focusing your thoughts on what's positive and what you're grateful for, as opposed to what isn't going right and all the negative, the more you can actually train your brain and rewire your brain to feel better. And if you look at a good example would be to look at you know, Holocaust survivors and why some went on to do incredible things like Elie Wiesel or you know, others who seem to be so filled with compassion and humanity and love for other people, whereas others, just the rest of their life was ruined, right? So
Viktor Frankl.
Yes. So his book is a perfect example about how if you find meaning in your life, you can live with whatever, you know, negative circumstances you've been dealt, and carry forward, you know, move beyond. But it's not like you move like it's gone forever or anything, but you're able to go forward despite the terrible things that may have happened. And it's all how you direct your thoughts. So, you know, it's such an important thing to understand that people have a lot of control over what they do in their circumstances, you know, rather than blaming others or, you know, just resigning to their circumstances or their mental illness, but instead being proactive, like your Project Proactive, and really looking at all the things that they could have control over and seeing, you know, what meaning they, you know, what can they offer the world that from their experience, you know, how can they help others?
That's a very impactful way to leave off.
Yeah.
Hopeful and empowering. Thank you so much. I really appreciate it. And if anyone had any questions for you, is it okay if they message you, or you prefer to?
No, they can message me. That's fine. Yeah.
Okay. So,
thanks, Shelley. One of my friends is on.
So if anyone has any questions, her account is Empowered Elyse. And
you can see what I'm interested in, right? I'm all about empowerment.
Yeah. So, and thank you everyone for coming, and
thank you for having me. This was really fun. This is the first live I've ever done in my life, so hope my eyes were in the right place. I don't know, but
and you're our first psychiatrist, so that was really exciting for me. I've been wanting to do this for we booked this a long time ago.
Yeah.
So I'm really excited that we did it, and I want to write it all down after, because there's so much to there's so much to know. Oh my God.
And I could just go on and on. So I like to educate and to help people feel like there's hope. Yeah.
Amazing. Well, thank you so much.
You're welcome.
Hopefully we'll have you again.
Thank you. Okay.
All right.
Take care.
You too. Bye.